Well, hi everyone. I'm the director for our New Zealand registered charitable trust, our not-for-profit, called Common Knowledge. We're an educational trust and we hold all of the skills that hundreds of fathers and mothers developed in the early 1970s in the United States, called Birthing Better. So I've been involved in the childbirth conversation for 50 years. So nothing really changes. Conversation changes, our bodies don't, giving birth doesn't. Medical profession changes, our attitudes about things change. But here we are today, and it's important that I try to deconfuse how we got here. I probably wouldn't have bothered if COVID had not come along. As soon as COVID came along, I realized that we needed to once again reconsider what the childbirth message was that we as women were giving to each other, what we as women and men were giving to each other, how we were integrating as modern people within modern maternity systems. And so here I am now out here doing series, You and Childbirth, and this is one of the series on risks. So humans have always given birth. Our bodies don't change. Until recently, we all labored and had a vaginal birth. So I want you to understand that there are two elements about risks in childbirth, and they have to be dealt with somewhat differently. One is suffering. And we've all, no matter what culture, wherever we heard women suffered in childbirth. And we didn't really understand what that meant, kind of, sort of. Women would kind of tell us, I thought I was going to die, which implies to all of us, my God, she's got some kind of an issue and she could die. But that's not what it means. What it means is that women didn't have skills to cope or manage or work through, deal with, handle, or feel in control when she experienced the normal, natural, and physiological pain of labor contractions. As soon as a woman gets pregnant, she knows she's lost control. Right? Baby takes over her body, and we take 9 months to adjust to that. And then if we're going to labor, we're going to leave out cesareans at the moment. If we're going to labor and have a vaginal birth, as humans have done forever and ever and ever, we women know that we cannot control labor. If we could, we would look at a watch and go, okay, I'm going to have contraction now. It's going to last 30 seconds. The pain level is going to be 2 or 3. I'll take a little pain. That's not a problem. Okay, it's going to stop now. Okay, we're going to wait another 10 minutes while I get something to eat. Okay, we're going to have another one. That's what women would do if they could control birth. But we can't control birth. Our baby controls birth. Our baby wants to get out of our body. So something has to control birth. Doesn't come from outside us, it comes from inside us. So our baby is stimulating our body. And we have labor contractions that we can't determine how intense they are. We can't determine how long they're going to last. We can't determine very much of anything. And so women suffer. They feel out of control. And that's why when I first gave birth in 1970, there was such a unique period and such an opportunity in the 60s and 70s to have a different childbirth conversation we have now. And we blew it. Women blew it. Okay? The first childbirth preparation classes ever taught around the world, were entirely skills-based. They weren't great skills because this was the first concept that women didn't have to suffer. They didn't have to be overwhelmed by the natural occurring pain. Those were Lamaze, Bradley, and in New Zealand, where I live, is Grantley Dick Reader, Childbirth Without Fear, which if you want to understand about fear, go to number 2 episode on this series. It's on YouTube, You and Childbirth series, where I talk about fear. It's nonsense. Women can be terrified of birth. It's nonsense that women have to not be afraid of birth, but I'm not going to get into that. So one of the risks is suffering. That's what women are terrified of. And the medical profession responded to our demands. So when my mother gave birth, when I was born in 1944, modern women were pretty much knocked out, right? Or they were given twilight sleep or something like that. So they wouldn't remember that they suffered, that they thought they were going to die. And then things changed in the 60s and 70s. Modern life came along, everything came along. We started to think a bit differently. We wanted to have our husbands with us at the birth. The first courses, Bradley was called Husbands Coach Childbirth. So fathers had skills, we had skills. We took 6 weeks of skills. We went home and practiced them. We timed contractions. They grabbed hold of our knee and squeezed really hard or gave us Indian burns on our wrists so that we had to breathe through pain. And we practiced for 6 weeks. Sadly, and this was where the mistake was, and I've talked about this before, so I'm going to be very quick about it. Those 3 men were obstetricians who then started to separate low-risk from high-risk women. And they targeted those skills to low-risk women, assuming they'd have low-risk births, and saying they could have a natural birth, pain-free labor with no medical interventions. That was the big mistake. They should have targeted 100% of pregnant women because 100% of us give birth one way or another. And if we're conscious, we should all use skills to reduce the risk of suffering. And my generation of women, multiple millions of us, did just that, except it wasn't seen as being a goal in itself. So remember, there are 2 aspects of risks in childbirth, always 2 aspects. The greater risk is that the women suffer in childbirth, that they can't control how they respond or feel when they're having labor. And I have had a conversation with a woman today who made me really want to talk about this. She suffered in childbirth, and then she had what she called an unnecessary cesarean. And her friends also suffered in childbirth. They felt that their bodies were going to break, that their pelvis was going to explode. They suffered. These are women that lack fundamental skills. Now, the skills that were developed in the 60s and 70s were the beginning part of skills. We all know that when we first learn skills, we feel like an idiot. And then we evolve and become a master of skills. And when we become a master, we refine skills and sometimes create more. What happened with that skills-based first approach, it got shut down by the famous natural birth advocates of the 70s and 80s. I was there. I know that this is what happened. They said skills don't achieve this natural birth, pain-free labor with no medical interventions for low-risk women. Therefore, skills don't work. Birth is natural. Women need to be left alone. Midwives need to sit in a corner and knit. And it should be all about choice. Women should just say no to medical care. So birth plans came up. So we as women have shot each other in the foot, and we have continued to do that for 40 years. And it's wrong. And we as women have to change this. We need to see that 100% of pregnant women will give birth, and 100% of us should self-learn birth and birth coaching skills, then use those skills to birth our baby, no matter what happens. Honestly, we got pregnant to have a baby, not a type of birth. We got pregnant to have a baby. It's an activity only women do with their baby. We can't invite anybody else to do it, no matter if there are 100 people in the room. No one can take it over for us. We have to do it. It's an activity, for God's sake. And if we did it as frequently as the physiological thing of having sex or the physiological thing of being hungry and eat, if we were doing birth 3 times a day, for God's sakes, of course we'd be skilled, right? Because we demand them. So we need to become skilled. So what's happening now is that the risk of suffering in childbirth has exploded again because childbirth preparation shifted from skills to information. So that's one thing. We can reduce the risk of women suffering by just building a self-learning, skilled birthing population and then telling each other, you don't have to like it. You don't have to like any part of it. They can do terrible things to you. You can have a horrible birth. You can be in the middle of war or famine, or you can come from an abused home. You can have multiple health issues. Everything, bad outcomes, everything. You can hate it. It's an activity you're doing with your baby. So use skills to do that activity. It's no different than the rest of life. If we're faced with a challenging situation, if we have skills, we feel more in control. We have to stop separating birth, pregnancy and birth from life, and realize it's just another activity. It's infrequent, it's a one-off, it can't be replayed, it's life transforming, we become a parent, it's an activity. So we can reduce the risks of suffering in childbirth by just growing a skilled birthing population, by telling each other and by birth professionals telling clients, you need to learn some skills and giving them a handout of the known skills skills-based methods they know about, or tell them to research it. It can change very rapidly if we can viral this message. Okay? Okay, suffering in childbirth put aside. Now let's talk about risks. It's not complicated, but it sounds complicated. This is what women end up. What if I have a problem? Or a doctor says, this might be a problem. So a problem is perceived as a risk. So let's take 1,000 women in a room who are all of a childbearing age, but none of them are pregnant. 1,000 women. There's a good sample. How many of them have health issues? How many of them have financial issues, abuse issues, substance abuse, physical abuse? How many of them have psychological issues? How many live in areas around the world that are challenging for people? So that there are risks. There are risks. It's just it. Life is full of risks. So what happens when all of those 1,000 get pregnant? Some risks get worse, some get better, some get more. Baby can have risks. What happens when women birth? There are other risks. So risks are part of pregnancy and childbirth. They always have been. When we hear natural birth movement people say pregnancy and childbirth are normal life events that rarely require medical care, we all go, oh, that makes sense. But nobody is defining the word normal. Or they are defining it. They're perverting that word to imply that it's safe and it's easy, it has a good outcome, and women manage it fine. But normal, natural, physiological pregnancies and births around the world throughout time meant anything that might happen could happen, that there are risks. Now, when there are risks, more people have risks, a lot of risks. Very few of those risks become problems. Of those risks that become problems, infinitely fewer become tragedies. So a risk in itself is not a problem, and a problem is not a tragedy. So if you have a risk in childbirth, it may become a problem, and unlikely, but possibly it may become a tragedy, and that would be considered normal, natural, and probably physiological. So let's compare pregnancy and childbirth to life, okay? How many risks are there in life? We're alive. We can't get out of it alive. We're all going to die at some point. So if you look in your country's Center of Disease Control and just type in, where is it? Where is dying for women to die of childbirth? Where is it as a common cause of death? What number is it? So I looked in the 80s, and it was, I think, 57 out of 65. So then I spent the next 3 years asking everybody I knew, what are the most common causes of death? And people would rattle off things like, okay, car accidents, heart attacks, cancers, suicide, homicide, and that's 5. So maybe people could get up to 10. They definitely couldn't get up to 57. So for a woman to die in childbirth, even though it's heightened now because of ethnic, racial, poverty around the world, women die in childbirth. That's true. However, compared to the rest of life, even when there is a high maternal mortality rate, compared to the rest of life, we're more likely to die of any other risk in our life besides being pregnant and giving birth. Pregnancy and birth are just a risk of life, and they have particular risks. So what about a baby? Well, if you research further, you'll find out that most babies that die are non-viable babies. They would have died. And, the same way, we can now save premature babies. They would have died. There's a risk. A premature baby at a certain point was a risk. Okay? So when women say, oh, if I have a problem, have a risk, they are treating it as though there is one risk or that every risk is going to happen to them all at once. And that's not accurate. So if you're pregnant now, you need to pay attention to what risks you might have. if when I gave birth in 1970, an obese woman wasn't considered to be a risk, nor was a woman having a breech baby or a twin baby or a placenta near the cervix or diabetics or women who had heart problems. Anyway, we all labored. 95% of us labored because the medical profession hadn't matured enough in 1970 to reduce risks. And we as modern women were accepting, just as the medical profession was, is that pregnancy and childbirth have risks associated to it. The risks of suffering, as I mentioned before, and risks that could happen. RhoGAM, to prevent babies dying from me having Rh negative, wasn't invented until almost when I had my last child. So you have to understand that modern people are risk averse. We changed maternity care. We demanded a change in maternity care. The maternity system didn't demand the change. We demanded it. And that's where people have it all wrong. We don't want risks. And so we use medical care. Okay? And this is the COVID issue now. Masks or no masks. Vaccination, no vaccination. It's just like flu. Let it rip. Well, if there was no medical care globally with this pandemic, the death rate probably would be around 6%, because the medical profession in all countries have stopped people from dying. They haven't stopped people from having long-term effects of this, but they've stopped people from dying. So when we look at the risks of COVID, we can sit there and say, well, just let it rip through our communities. That's okay. So if we take that attitude about COVID, then why aren't we taking that attitude about pregnancy and childbirth? Whatever happens, whatever happens. And in fact, when I gave birth in 1970, there wasn't much choice. Cesareans were done to save a woman's life, and they were major abdominal surgery, and they had repercussions. So women demanded change, and they demanded change to reduce the risks. And the funny things is that risks can be big, life-threatening, or they can be little, and we look at them and go, what's your problem with that one? So one of the biggest changes from the cesareans, the classical cesareans that we had, where we were knocked out, major abdominal surgery, left with a scar from our pubic bone to our belly button, was we started to wear bikinis. Honestly, we, on my generation, changed cesareans. We didn't want to be left with an ugly scar. To us, that was a risk. I know, it sounds like vanity. It was. Women felt ugly. They didn't want to feel ugly. When their belly looked like that, they were embarrassed about their bodies. They were embarrassed with their partners sexually. They didn't want to wear attractive clothes. So we demanded a change. And the medical profession came up with a bikini cut. They didn't invent that. We demanded it. They created it, right? That made cesarean safer. It made, and we demanded that our husbands be with us in a cesarean, so we didn't want to be knocked out. So the medical profession came up with the spinal and the epidurals, so that we could have our partner with us in a cesarean. That's good. It's not necessarily bad, okay? But these are things that we consider to be risk factors and risks that people are going, but it's not a medical risk. You couldn't die of that. People don't see risks as life or death. They see risks as anything. Think about stranger danger. The stranger danger didn't exist when my child was born in 1970. By the 80s, when my last kid was born, it did. We told our kid, don't talk to strangers. We considered strangers to be a high risk. That developed helicopter parenting. And the reality is that 98% of all abuse comes from people we know. We don't really have a danger with strangers. It's good to meet people. It's good for our children to meet new people. It's good for us to let our children range a bit, but we're so risk averse, and we're risk averse of the unknown. And so when my generation started to change how cesareans were done, we weren't left with an ugly scar. We could be awake. We could try for vaginal birth after a cesarean without as much of a risk of a uterine rupture. And we then demanded that the risks of our twins or our breech babies be reduced. And because the natural birth movement, because doctors use forceps, right? And then the natural birth movement said there are risks of forceps. There are risks of forceps. Some babies were damaged. And why were they damaged? Because our bodies were tight. And why were our bodies tight? Because nobody taught us the skills to prepare our body to open up for this grapefruit-sized object. And so from the doctor's end, they see a tight crotch. The baby is having difficulty coming through the body. It's a breech or a twin. They used forceps, extracted the baby, or did internal versions or manual extractions of the babies. And then in the 80s, the natural birth movement said, forceps damage kids. There are risks. There are risks. So what happened? More cesareans, right? Oh my God. So we as women have been the driver of risk reduction in childbirth. We don't want our babies to die. We don't want to die. So we demand the medical profession reduce those risks. So how do you deal with that? You're dealing with suffering if you labor, because you now aren't being taught skills. There's no societal message out there at all that it is normal and natural that all expectant parents self-learn birth and birth coaching skills and use the skills to work through the activity of birthing your baby, no matter where you birth, no matter who's present, no matter your beliefs or your circumstances, your choice, your lack of choices, your change of choices, or what happens to around you. You never have to stop using skills. Why people don't have skills is because women blocked it. Why we don't use skills when birth is unfolding in ways we don't like is because we as women tell each other that the only good birth is this natural pain-free labor with no medical intervention. So we stop using skills to birth our baby. And we have to change that. You know, it's like driving a car. You learn skills. Everybody who drives a vehicle has to learn the same skills worldwide. And every time you're behind that wheel of the car, you have to adapt and adjust those skills to circumstances at a nanosecond rate. No, it's not physiological, but it's a good example of what happens. So if you hit a patch of ice or a dog runs across the road, you heighten the use of your skills. If you're driving through a snowstorm for hours, you heighten the use of your skills. We don't have that attitude around childbirth, that you should heighten the use of your skills if birth is unfolding in ways that are challenging. So we become knobs, we become passive, and then we blame them for not giving us a birth that we wanted. And this is where it's become crazy. So if you are identified as having a risk, you don't have every risk. You need to find out what your risks are. There are statistics. Statistics are incredibly difficult to fit into. Here's the reality of statistics in childbirth. If you fall into those statistics, you fall into them. If you fall out of them, you fall out of them. So there's no way to know until after the birth. So what's the best way to deal with a risk? Become skilled. You might be able to mitigate the risks. Some you can mitigate, some you cannot mitigate. But you still have to do the activity of birthing your baby. And if you do the activity of birthing your baby with a set of skills that adjust and adapt and are sustainable, and you commit to using and hopefully have a birth coach with you who helps you feel in control, then you reduce the risk of suffering for yourself. And you proudly work through this very challenging, one-off, infrequent, can't be repeated, life-transforming, dynamic experience as best you can. And you will always birth better, no matter the risks, if you are skilled. And the more risks you have, the more skilled you should be. So there aren't a bazillion risks. That's misspoken. There are finite risks around pregnancy and childbirth and added risks. So for example, many years ago, I worked with a woman who was a midwife. I'm not a midwife, I'm not a childbirth educator, I did body work. And I proudly developed skills with hundreds of families in the 1970s. And I was asked by those families to carry them forward. I put all of that into a not-for-profit trust called Common Knowledge. but I have been at a lot of births, and I was friends with a midwife. Her daughter had IVF and got pregnant with triplets. Okay, they did 27 scans and never found that third baby. Okay, 27 scans and never found that third baby. And on the way to the hospital, a drunk driver hit her in the car, her mother and her. They went into the ditch, and they were both alive. They went into the hospital. The first baby was delivered, and it had passed away. The second baby lived, and plop, there was a third baby that they never found. She didn't believe that, she believed her risk was she was overweight and having triplets. She wasn't even having triplets, she was having twins. There was triplets. That was her perceived risk, and then she got in a car accident on the way to the hospital, right? 2 of her babies died. The third one was a vegetable for 15 years and then passed away. We cannot reduce risks, okay? They're going to happen. Life is a risk. We're living a risk all the time. I could drop dead right now, right? So when you're pregnant and you have perceived risks, identify them. And identify how many of those might become a problem. If they're saying to you 1 in 10,000 that might become a problem, ask them, of that 1 in 10,000, if it becomes a problem, how many of them become a tragedy? If they say, well, that 1 of 10,000 becomes a problem and it does become a tragedy, then you know you could be 1 in 10,000. What does that mean to you? Well, is it something that you can help reduce the potential of that risk from becoming a problem or a tragedy? Maybe or maybe not. If you're Rh negative, you take a RhoGAM shot. If you have access to it. If you're having a breech baby now, everybody believes that they need to stand on their head for months to get a baby into a perfect position. Totally ignoring that head-down babies can have risks involved as well. Totally ignoring the fact that if they learn to open their body, create space and mobility and softness in their body, that their breech baby is much less at risk than if they have a tight body. They don't think about learning skills so that they can cope with a natural occurring pain, so that they don't end up suffering where the medical profession wants to just stop the suffering, or they don't do anything to reduce the potential of having a long first or second stage because they get into positions that just cause, like hands and knees, that can cause the labor to linger for a long time. So you need to understand that risks are part of life. Pregnancy has risks. Childbirth has risks. So your first line of defense is to become highly skilled. If you're at home and someone chokes on food, learn the Heimlich maneuver, for God's sake. Okay? Learn CPR. These are simple skills that you can help reduce the potential risks from becoming a problem and becoming a tragedy. For some reason, we have just become so disconnected, women to one another. We have this ideal birth. Okay? It's like all these pregnant women are going to give birth, but we don't care as women about all of us. We don't care about all of our births. We really only care about an ideal birth. And I want to put up on the screen what New Zealand midwives consider to be an ideal birth. When you read this, this is impossible. So few of us achieve that. And all of those things in that list can still end up with a dead baby, or a baby with a problem, or a mother with a problem. So we're just focusing on the place of birth, the type of birth, or none of that. Okay? And with this risk mentality of denying risks, of not developing a skilled birthing population, what we as women have told each other since the 1980s is say no to all of the assessments, say no to the monitoring, say no to the procedures because they are imposed on you. Go back to that statement that pregnancy and childbirth are normal life events that rarely require medical care, and treat that as though it's a gospel truth and that the word normal means safe, easy, good outcome, and manageable. We as women perpetrate this myth to one another. And we as women have caused the exacerbation of shame, blame, guilt, disappointment, anger, frustration, and emotional birth trauma. Because we as women are telling each other we have to avoid all of these in order to achieve this ideal birth. None of those things that we're supposed to avoid are really being imposed on us. If we don't want modern medical care, don't go to a doctor. Don't go to the hospital. There are millions of women around the world who have no access to medical care. They birth with whatever risks they have, and those risks may become problems, and tiny percent of them become tragedies. But many women are still left physically damaged. Emotional damage, not so much, because traditional women just know that life is full of suffering. So they accept the suffering of childbirth, even though they don't like it, right? But they can be physically damaged, and that becomes harder to live your life. If they lose a baby, they often will have another baby. Because here's the reality of our risks. Until immunizations and antibiotics, if you go to any cemetery around the world, any culture around the world, we expected to lose between 20 and 30% of our children before the age of 5. And that's why we often had big families, besides the fact we didn't have any contraception or safe abortion. So immunizations and antibiotics has reduced the risks of infectious diseases and dying of infections. So what we're doing to each other is giving incredibly difficult and mixed messages. And what we want to say as a trust, and what I want to say as a director of a trust, now that I've decided to become public because of COVID, is that we need to grow a skilled birthing population. And this is how you do it. So all of you who listen to this, carry on this message, at least pass it on to 5 people. 5 people, friends or relatives through social media. Because everything starts with an idea. Everything have words to explain that idea, and those words have to be simple for other people to say. And then we have to have actions. And those ideas have a result in mind or a goal in mind. So the natural birth movement, starting with Lamaze and Bradley and Grantley Dick Reed, the idea was that low-risk women, if they learned skills, could have a natural birth, pain-free labor with no medical intervention. And the actions were to learn Lamaze or Bradley and apply those beginning skills that hadn't yet evolved. And what we found out was not enough women achieved those 3 goals. The biggest place they didn't achieve was the pain-free labor, right? Because there's no way to control it, okay? And pain is a perception. And there are many women who use skills, who hate labor, find it incredibly painful. I'm one of them. And we cope well because we apply our skills. No different than we would in the rest of our life, giving challenging, painful experiences. Think of how many parents, their kid hurts themselves and starts bawling, and the parent goes, take a deep breath. That's a skill we're trying to teach our children, to manage pain and hysteria. We should be doing that for ourselves. So the concept that Birthing Better Families developed, and that almost Lamaze and Bradley almost should have developed, was 100% of pregnant women are going to give birth. One way or another, it's an activity that we're going to do with our baby. It should be normal and natural in pregnancy to self-learn birth and birth coaching skills, and then use those skills to work through the activity of birthing our baby, even if birth unfolds in unexpected ways and ways you don't like. This is an easy message. You can replay that. You can learn how to say that. And what's the goal? The first is to reduce the risk of suffering. That's the first thing, that women and men feel in control and cope better. That's a good goal. It is good for us not to be hysterical and not to suffer and not to feel overwhelmed. So you can say that. It's normal and natural in pregnancy to learn birth skills and then use them. at least so you don't suffer. Birthing better skills were developed by fathers and mothers to also try to reduce some of these risks from becoming problems and becoming tragedies. That's a harder thing to talk about because there are a lot of risks and they're all glommed into one. So if an individual woman is pregnant with a breech baby, that individual woman can prepare her body. She can learn what the map of her bony pelvis is, what the space is her baby needs to come through. It's an object. She can, with her partner, develop space in that bony structure, soften the soft tissue inside, prepare all of her vagina. She can then have skills to cope. She can learn to read contractions so she has an effective progressive labor. And she can work through this activity. Can this breech baby still have a risk? Yes. Can she reduce the potential risk of a stuck head? Yes. Or arms up and not coming up? Yes. Because the reasons that babies get stuck is because the woman's body doesn't open. The sacrum doesn't move. The tissue doesn't expand. And the women are often in positions that compress the space. So can we reduce some risks by using effective skills like birthing better? Yes, we can. But it's on an individual basis. And it's coupled with skills to work through the birth. And the commitment that we had, which was to always use the skills to work through our baby's birth. If you're a birth professional, how do you explain this to clients? Simply, you just say to all of your clients, I'm going to respect your choices if that's what you do, and it's an activity you're going to do. Here's a bunch of skills-based methods I know about. Choose one or more. At 24 weeks, we'll start to put in your notes what skills you've learned so that we have a record of them. And at your birth, if you look like you're coping and managing well, we're going to praise you for doing this activity well. And if you look overwhelmed or you sound overwhelmed, anyone can refer to your notes and say, you learned breathing skills. The woman might say, I said I did, but I didn't. Well, then you have to deal with that. But if she said, I did, but things have changed, I don't think I should now use them, you just remind them it's your baby's birth. You can always breathe and use relaxation skills and teamwork skills with your partner. Even driving to the hospital, even being prepped, even lying on the table feeling numb from your boobs down where you have a non-laboring cesarean. It's your baby's birth. Whether you have risks, whether risks come up, whether you end up with whatever, okay, whatever. So how do you deal with risks? Identify them, find out if there's anything you can do about them, learn skills to work through the activity of your baby, and the chances are that you are going to die of anything else, or that your baby is going to be dead or injured from anything else than giving birth. That does not mean to take a lackadaisical approach. It means to become highly skilled to do this one-off, infrequent, life-transforming, dynamic, important experience. Now, some people say to me, well, driving a car isn't physiological. Give me some physiological analogies. Sex. It's physiological. If we only had sex 5 times in our life, and that's a lot of babies, would we want to become skilled to do it better? Damn right. Hunger. If we could only eat 5 times in our life, would we want to know what foods are safe and how to prepare them to have 5 delicious meals? You bet. But women have degraded the concept of childbirth, and we need to stop doing that to one another. People can dislike what I say. That's fine. Change your attitude. Giving birth is an activity, and all of us need to be skilled to be able to do that. So thank you very much for listening. Please donate to our trust on our websites. Please subscribe to our YouTube channel. Please share these talks with other people. You're responsible for making a change in childbirth. I'm one voice. If I can't amplify this voice out across the nation using social media, then I will have spent 50 years of my life at this point really, really, really being shouted down by other women. And you know what? I'm going to keep talking now, because there are people out there who can understand what I'm going to say, and then it becomes your responsibility to amplify this message. Thank you for listening. Bye-bye.